difference between a psychiatrist, a psychotherapist, and a counselor?
Behavior is, and relating that to the brain chemistry, psychologists are somebody who has done. Counselor, anybody and everybody call themselves people even with a lot of experience in life. They can be a good counselor.
It's probably sometimes it becomes a hearing person. How do you think psychiatry, where people have to come and consult the doctor, changed over the past decade in India?
Sometimes they are extremely anxious.
So is it true that once on medication, throughout your life you have to be in medication? Hello everybody, a very good day to you. Today, welcome to yet another episode in Go Make a Difference. Today I have an incredible guest with me who's sitting next to me, with whom I'm going to be spending at least another 2 hours, knowing the know-how about psychiatry, as they say, right? The subject. So one of the most distinguished person in the field of mental health, welcoming Dr. Girish Chandra to our episode. Thank you so much for taking your time, Doctor, to do this for us. It means a lot to us. Thanks once again. So directly jumping on to the crux of the episode, right? Why psychiatry? What made you choose psychiatry?
That's a very, very interesting question. During my medical school days, I did come across some of my very close friends who went through mental health related issue, and there were some very, very tragic circumstances during what they were facing, those problems, and that actually is one of the reasons why I'm here today as a psychiatrist. That led me to pursue my post-graduation at NIMHANS, and then following that, I'm here today, whatever I am.
So now you've taken me to the next question, right? So that is a very common question that everybody has. Even in fact, even I have that. What is the difference between a psychiatrist, a psychotherapist, and a counselor?
Okay. So let me clarify the first thing about a psychiatrist. A psychiatrist is actually a doctor. Okay, you have to be a doctor before you can become a psychiatrist. So you finish your medicine degree, basic MBBS degree, and after that you pursue post-graduation. Just like some people pursue their post-graduation in ophthalmology, for example, or medicine or surgery, and only after that they become surgeons or physicians. Like that, we have to pursue post-graduation in psychiatry, and so either you do an MD or a DNB, we call it. So once you pursue that and once you finish your post-graduation in psychiatry, then you become a psychiatrist. So the thing with psychiatrist is that along with pursuing the brain, the anatomy of the brain, the physiology of the brain, and so the functioning of the brain and neurochemistry, neurophysiology of the brain, you understand that and you try and relate that to what's happening with mental illness with respect to the functioning of a person and what their behavior is, and relating that to the brain chemistry, brain mechanism. So that is what a psychiatrist does. Along with that, they also study psychology. They also read about the development of practice of psychiatry, how it has started, to understand that, and that's what makes a psychiatrist.
Okay.
So the next one is a psychologist or psychotherapist. Psychologists are somebody who has done their MSc or MPhil in psychology. The ones who do MSc, they generally use the term psychologist, but the ones who do MPhil in clinical psychology, they call themselves as clinical psychologists. Okay. They get to do a lot more in-depth work with respect to people who are suffering from mental illness, whether it is assessment, whether it's coming up with a structured treatment plan, whether it is psychotherapy that is needed, or any other corrective strategies they have to take that way. Okay. And then counselor, anybody and everybody call themselves can call themselves counselors. It's a very, very broad terminology. Sometimes people even with a lot of experience in life, they can be a good counselors. they may not be able to do in a structured way. They may understand, they may not be able to understand the problems, how they are affecting. Sometimes they are able to do a good job, but it is not possible to consistently guarantee the actual work that is needed for a particular person. A regular counselor will be able to do that. Whereas a person with a proper degree, proper training, most of the times they are able to do the right thing for that particular person in front of them.
Okay.
So that's why it is better always to go for a trained, certified psychologist or therapist rather than going for a regular counselor.
Okay.
So, but somebody who needs a proper assessment, a proper therapy, proper treatment, whether it is medication, whether it is non-pharmacological or non-medication type of strategies, it is better to come to a psychiatrist first and then get redirected depending on their needs.
Okay. So a lot of people are becoming counselors, like our friends also become counselors at times, and it's probably sometimes it becomes a hearing person where you just go and talk and vent out things, right? Yeah. So they can also be called a counselor, right?
See, there are a lot of very, very good counselors who have not done their formal training. For example, many a times in certain problems like which human beings face, like for example, I have seen extremely good counselors in addiction related problems. Somebody who has been through addictions themselves, who their personal experiences, what made them come out of the problems and things like that is extremely useful. But not every person who has been through a problem can be a good counselor.
Right.
So they need to have that type of mentality, that type of mindset that probably can help them to become a counselor. So it depends on person to person. Some of them are good at what they do and they might become good counselors, but it is not always possible if you are not trained in the proper way to be able to understand the problem and always give a proper solution.
Could you please tell us your journey in psychiatry?
So coming to myself, I finished my medicine and then I joined for my post-graduation at NIMHANS. So it's like you be in NIMHANS, you get to learn even if you don't want to learn. So even if you without realizing, sometimes you're learning, because the type of people who are there, the type of teachers, the type of students who come there. So it's in the air of NIMHANS where you are constantly learning. And also the most important thing is the number of patients who come to NIMHANS from all over the country seeking help. So when they come there with their own problems and the same diagnosis will have different manifestations, different type of presentations, different problems what they are facing in life. You get to see so many people with so many types of problems and so many types of unimaginable circumstances. That gives you a much broader outlook, much broader ability to take information and have developed that non-judgmental way of looking at things. From there, while I was almost finishing my post-graduation, then I got an opportunity to go overseas. Initially, I went to Australia, where I worked initially for a little while as a trainee, and then I became a consultant over there. So I worked in Australia for 4 years. So, and then following that, I got an opportunity to move to UK, and I worked in England as a psychiatrist, a consultant psychiatrist there for 10 years. And 9-10 years ago, I had an opportunity to come back to India again. I always wanted to come back. So I took that opportunity again and returned to India. But working in different countries, you go and see the problems what people face, and the type of people they are, the nature of the people, the problems they experience, and what is the manifestation of their illnesses. Then you get to see that the people are from different country, they have different color of in terms of their skin, but the problems are same.
So that's after coming back to India is when Maarga happened.
So after coming back to India, I worked in different places. So I've been involved in setting up hospitals, developing services, and so worked in that along with continuing to practice as a psychiatrist. In the last 1 year, I have been working as part of Maarga as a medical director and chief psychiatrist. Though initially it was part of People Tree Hospitals, now it's an independent entity, Maarga Mind Care, and we have outpatient settings, inpatient facilities. We do all possible therapeutic interventions in Maarga. We have a group of psychiatrists who are very experienced and a lot of skills. And we have around 10-12 psychologists who work with us. We have child psychiatry, we have old age psychiatry. Basically anything to do with mental health and related presentations and whatever type of interventions that is needed, we are able to take care. That is a kind of standalone mental health facility Maarga is.
That's amazing to hear. Okay, so you've had such vast experiences across the globe, right? How do you think psychiatry, where people have to come and consult the doctor, changed over the past decade in India?
So I have been seeing people with mental presentations in India from 90s. So compared to those days and today, there is definite difference. So there was a lot more hesitation, a lot more reservation in seeing a psychiatrist. So today it is a much a better situation. They're much more open about seeking help. But that doesn't mean there is no stigma today and no misconceptions today. There are still, but people are much more open about seeking help, and especially even so after COVID. During COVID as well, there was a lot of people who sought mental health input. Like if I look at the hospital where I used to work before, so most of the physical consultations stopped during COVID because there was people didn't means. They were advised not to step out and people didn't want to come out, and for those reasons. Then the sort of teleconsultations, video consultations, these things started happening more. So if we compare to different specialities, psychiatry was one such specialty where video consultations were happening much more, and probably we had the teleconsults increase, the number of consultations we were having per week continued to remain same for psychiatrists, or even more during COVID compared to other specialities.
Oh, okay.
Their consultations went down to begin with, and gradually they also picked up with teleconsults and all, but still compared to the number of consultations which was happening in psychiatry, it was a lot more than other specialities. This is what I observed in my hospitals and quite a few hospitals in and around.
Was it because of the COVID? I mean, in the sense like people suffering from COVID, they wanted some mental support, or?
See, a lot of things changed during COVID. Even if you look at the working environment, say for example, work from home. There was work from home before, but not many people were using the term work from home probably. People were logging in from their homes or elsewhere for, say, one day they would have taken permission or something along those lines that was happening. They would join meetings at home even after coming back from home. All those things were happening, but never realized that this can happen as a long-term practice. So that was one big change. So people if they wanted help, so it is possible to seek help this way. I think they became more open about it, and also the privacy what it was offering, that was another factor. And the other thing is that, see, general physical examination is an absolute must in medicine. When somebody presents to you with a chest related problem, you need to examine them. If they present with an abdomen related problem, you need to physically examine them. Sometimes even that need is there in psychiatry as well, but many a times we can do an examination with general discussion and talking about it. So I think for those reasons, I think it was much more the frequency of that happening was more in psychiatry. It continued to happen. So a lot of these factors, and we were also advising people to sort of seek help over the phone or seek help using different platforms in those days, including the government advised ones, isn't it?
Right. Yes.
Yeah.
So when you say psychiatry, right, what kind of people actually come to you?
Okay. So people, the people are pretty much like, if you see, they're all facing the same kind of problems. Whether sometimes they might be facing problems in their personal life, or sometimes it might be to do with work life, or it might be some other stress related to financial reason, family reasons, property related issues, other disputes, or sometimes it might be neighborhood related problems, and so whatever that might be. So whenever there is a sort of some kind of a stress, they might end up with some kind of psychiatric problems. So the problems might be sometimes related to anxiety. Sometimes they are extremely anxious. So the anxiety might be because of certain circumstances, or sometimes even without any kind of cause, without any kind of precipitating factors, they might be having anxiety related problems. So anxiety means, as you know, you start worrying about things, you start becoming anxious with little things, and when it takes over your life, that becomes a problem. All of us have anxiety. We might have occasional anxiety, occasional low mood, occasional anger. That doesn't mean that we are having psychiatric problems. When any of these problems become so much so that they start interfering with our personal life, or it starts interfering with our social life, it starts interfering with our occupational life, so that is when they become problem. That is when they seek help. So these are the type of people who come to you. They don't come to you because they have anxiety. They come to you because they are having problems in coping with either any of these aspects of functioning of their lives. So they come to us with these problems, and once they come to you, then you start assessing them, then you start exploring what might be the problems. Then sometimes it is to do with anxiety, sometimes it is to do with depression, sometimes it is to do with much more severe mental health presentation. So when I say severe mental health presentation, that's when people use unfortunately the terminology called crazy, or people who say that they are experiencing the world in a different way. So they are struggling, they are suffering much more. So but the problem will be because they are not able to sleep, or they are not able to eat, or they are getting into problems frequently with others. They are not able to go to work, and these are the kind of problems they present with. But the cause for those problems might be any one of these. It might be anxiety, it might be depression, it might be psychosis, any one of these things. So they present that way, and then you have to explore, then you have to diagnose, then you have to start treatment for any of these causes depending on the needs.
So is it on the high? Because these days anybody and everybody whom I talk, every second person says I'm under medication. I'm taking this tablet, I'm very depressed, I'm very stressed. So that's become, like how you said, crazy, and stressed has become the word right now that's buzzing around.
So if you ask me, is there increase in mental illness in the recent past?
Right.
Actually, there is no increase in mental illness. The incidence of mental illness has been the same over the decades or even centuries.
Okay.
But the like, say for example, you would have seen somebody who is an extremely anxious person. They have been an anxious person all their life. They never realized that it's a problem. They never realized there is a help for this problem. They never realized where to seek help for this problem, like that. Then there are people who were depressed and continue to be depressed and never sought help, right? So these kind of problems were there, but they didn't know. The ignorance or the stigma prevented them from seeking help. So from that situation to currently, where people are much more open. For example, sometimes even the families or the parents might say, my child is not coping well, and seeking help for that has increased. So they are much more open about the problems. So from that point of view, Yes, today people are telling that I'm stressed, I'm on medication, I'm seeing a counselor, I'm seeing therapist. So these kind of things they are openly telling. And I think in a way, if you ask me, has it become a fad or has it become sort of it gets more attention? Whatever more people are talking about it. But at the same time, it's not everybody. Still, there are a lot of people, quite a significant percentage in population, who still avoid seeking help, and sometimes even educated ones. They get misunderstanding or they perceive it differently, and they don't seek help. So you see the both spectrums so people who are trying to seek their help from unrelated sector and trying to avoid seeking help, those spectrum is still there,
Still there.
but a lot more people are seeking help and a lot more people are much more open about seeking help.
When they come to seek help, right, generally a psychiatrist will prescribe any medications. So is it true that once on medication for any psychiatric related issues, throughout your life you have to be in medication?
Okay, the two things which I sort of see in the question. Once you see a psychiatrist, there will be a medication. That itself is a misconception. So when you come to see a psychiatrist, so following assessment, if the need for the treatment is medication, then definitely medication will be advised. So, does it mean that there are other ways of intervention? Of course, there are other ways of intervention.
Okay.
Medication helps a lot of people, but there are lifestyle changes, for example. So basic things, good lifestyle, which includes exercise, which includes good diet. Those things are also part of the treatment plan. So that itself is enough in certain mild and moderate type of mental health related problems. For example, mild depression or some of the patients suffering from moderate depression, for them regular exercise itself can be enough intervention. So that itself can bring about the chemical changes that is required in the brain, which will lift their mood, which will help them to fight the stress hormones and come out of the problem and get back to the normal functioning. So in such situations, the psychiatrist will advise them just to go for lifestyle changes. So then there might be counseling or therapy type of interventions which might be helpful for them. Then there are other types of interventions. We call it as interventions like say procedures type of interventions, which is there is a particular treatment called as RTMS, which is transcranial magnetic stimulation. So that is like using magnetic waves to stimulate the brain. Then there is transcranial direct current stimulation. So where there is a very very minute amount of electricity is used to stimulate certain areas of the skull and brain, and so which will stimulate the brain tissue, brain neurons. So and which will help in overcoming certain type of problems. So you might use those things, or you might use the counseling techniques or therapy techniques, or different types of psychotherapeutic therapeutic interventions. So these are might also be a way of treating a particular problem. So if you ask me, a psychiatrist does this. Many a times a psychiatrist also are able to do these interventions, but sometimes they also use other people who are trained in this to do these interventions.
Okay.
And then they also prescribe medications.
Okay.
Coming back to medications, once if somebody is on medication, does it mean they have to be on permanently on medication? Not the case. So if you ask medication, by the time they come to a psychiatrist, many of them are suffering from problems for weeks and weeks and months and sometimes even years. For problems which have been going on for such a long time, expecting everything to be sorted in one go, or take a medication like an antibiotic for 5 days or so, that's cleared. It doesn't work that way. So medications in psychiatry take more time to start beneficial action. So you might have to stay on medication for longer durations. Sometimes the medications you might have to stay on for weeks or months, and sometimes even years as well. But that doesn't mean all the time once you go on medication, it's permanently you have to be on medications. If you take examples in, say, the commonest illnesses which people suffer from, for example, diabetes, or if you take hypertension, if you take other chronic heart problems or kidney problems, you are on treatment for lifelong. You have to take treatment continuously, isn't it? So like that, there are a few conditions in psychiatry as well, where you might have to take treatment lifelong. But there are indications for that. Then there are plans for that, how you do it and how you minimize the problems, how you minimize the side effects, and what kind of strategies you need, and how frequently you need to see the doctor, and all those things. Duration of the treatment needs to be sort of discussed with the doctor, and that's a two-way street. It's not just the doctor tells you. Doctor tells you based on how you are doing. If you are coping well continuously for, like, say, 6 months, and you go to the doctor and say, look doc, I'm doing well, doctor will definitely be happy to talk to you and try and see if coming off the medication is an option. But it's don't make that decision yourself. Don't have that idea before going to see the doctor, and don't have the idea before starting the medication. So be open-minded. Feel free to ask the doctor and discuss and come to a plan.
So self-realization is not actually accepted.
Self-realization, if you're talking about, okay, I'm well today, I'm well enough to stop the medication today, if that's what you're talking about.
Yes.
And I would say no, that's not such a good idea. You might be on top of the world, you might be feeling that you are capable of managing anything life is throwing at you today, but discuss that with your doctor. So, and then come with a plan.
Okay. So when will one know that he or she has a problem? That itself is a big question mark for a lot of them, right?
True. But I would say, when, like, there are certain basic criteria we look at. If somebody is suffering from a problem, but the problem is persistent, that is causing a lot of distress, that is affecting your day-to-day functioning.
Is there any example that you can quote?
Like, for example, let's say the commonly suffering problem, like, say, depression. We all have periods where we might feel sad, and so, for example, we might sort of come across situations where somebody has lost somebody in their life, or there is a relationship problem, and you might feel low for a while, and generally sort of you overcome that and you get better gradually, and that is not exactly depression. But if the problem is such that the mood is so low and you are affected so badly that you are losing interest in everything in life, and you are not even able to sleep, you want to sleep, you can't sleep, or even if you sleep, you get up frequently in between, or you wake up early in the morning and can't go back to sleep, that's one problem. And then you lose appetite, so much so that you start losing weight significantly, and then you stop interacting with outside world, and so you stop going out and stop talking to people, and you start feeling the world is sort of so negative that everything that's happening around you, nothing can help you anymore. And so even extremes where you start feeling like ending your life, and that's the depression overall. But if you take what were the problems why a person came, initially it will be for, I can't sleep properly, I'm losing weight, I am not able to, I don't find motivation to go to work, I don't feel like going to work, and those are the kind of problems people commonly come with. But if you explore further, depending on the severity of the problems, it can go from that extreme to the other extreme.
Okay. So can you quote one example where people, a person who's just randomly walked in telling that I'm just stressed at work, but it had a huge underlying problem, which actually led to a serious diagnosis, and you had to really, it was a long term association that you had to have with that patient and under medication, which seemed to be very silly at the start, but actually it had a very big history.
So I came up recently one of the situations where the initial complaint was that person had come to work. It's a prestigious multinational company, and they had come to work under the influence of alcohol. That's all it was. Sort of, it might have been just 1 day or 2 day, whatever it is, but the reason for patient coming to my contact was that they had gone to work after consuming alcohol in the morning itself. So, but once you sort of, sat with the patient, you started talking to the patient and talking to the family, you got to know that the alcohol was just a manifestation of the underlying problem. For a few weeks before this particular incident happened, the person had become more energetic, they had become over friendly, they had started spending more money, they had been buying things which was not needed, they had become erratic, there had been few incidents in the workplace where they had been getting into frequent arguments and conflicts and fights with people. So then you started realizing they were actually having an episode of what we call as mania, where person completely goes to the other extreme compared to depression. So this person was having a manic episode, and they were even having, along with the sort of this elated mood and increased energy type of behavior, they were also feeling suspicious about their colleagues, and they were worried about somebody might be harming them. And in mania, sometimes it can go to the extremes of losing touch with reality, where you might start feeling you're in touch with God, you might become extremely grandiose, and you might spend money thinking that you have a lot more money than what you
Hallucinating,
have.
basically.
So hallucinations also can occur in people in mania, where they, for example, they hear neighbors talking about them, or God speaking to them, or even those kind of things. So this person was going through a lot of those symptoms for more than a month, and as part of that they also become somewhat disinhibited. Sometimes if it is a male, they might try to charm girls, they might become more flirty, and if it is a female, more again in a flirtatious behavior, or trying to be over friendly. And sometimes unfortunately they can get into judgment related problems, where relationships, unwanted relationships can be started, or they might also end up breaking relationships as well. So this particular person, there had been problems where so they have got into problems with colleagues, they had been more challenging with their supervisors, and their work output also had got sort of affected. And then on top of it, this behavior which showed that they were not thinking properly, their judgment had been impaired, and that's how they came to us. So when we started exploring, when we started addressing the problem, we could also see they were on the verge of losing the job as well. So then we had to address with the patient, start the treatment. So that itself is a challenging situation, where they didn't see the need for treatment, because they are feeling on top of the world. I'm feeling fine, I'm okay, why do I need to take any treatment? Whereas everybody around them, the father, the husband, everybody around them were sort of really concerned. So we had that first initial situation where we had to really convince them to take treatment, sometimes even force them to take treatment. So from that point of intervention, to gradually making them understand, gradually making them realize that they are having this particular problem, and helping them to get better. And then with the permission of the patient, we had to liaise with the HR and workplace as well, where we had to explain to them that there were lots of whatever disciplinary things that was happening at workplace, that was secondary to this particular illness. And if not for the illness, the person who has been doing the job for the last 10 years and doing so well, suddenly why they are having this problem. So we had to make them see that and understand. So they were able to sort of, once they understood this is an illness, they were able to initiate within their HR department whatever the illness related interventions, what they have to initiate. They started that, and then they were able to help the person get better, and when they got back to their job, reintegrate with the team and all that. So, but if the person had said no to us contacting the HR or using their support, it would have been much worse situation. But here we were where the family was extremely helpful, and the HR was very, very, they had very good support systems in place, and the patient themselves were much more willing to use these support systems. So the problem which started as a alcohol related problem at workplace actually had a severe mental illness who needed a lot of input from a lot of these different avenues.
So there was a small trigger point for that person that has actually come up, right? So here the entire family was very supportive in this case, but most of the cases the family is actually not supportive, isn't it? I mean, when this person is saying that I want some help and I'm going to a medical professional for my mental illness or whatever you name it, but the family will say, no, why do you want to do all that? Don't do all that. Even now probably in South Indian families, or I don't know, even now in India, whomever I see, they say no, don't do all that. I don't think you should do unnecessarily, don't waste time.
That is certain circumstances, you are right. But here it was actually the person themselves did not see the need to seek any help. It was actually started by somebody else. Look, this person seems to be having problem. Please get them get some help. This is the kind of instruction which came from workplace. A person seems to be having alcohol problem. Get them to see a doctor and sort it out. But once they started seeing the problem for that, then you realize they are an underlying mental health illness. So everybody came around. The kind of circumstances what you are talking about, we see that regularly. I've seen where teenagers who are going home and telling, I'm not coping, I'm struggling, I'm having issues at school, and the parents are telling, what is the big deal? You're being very weak, you're not taking care of self, just walk it off. That's the kind of outlook what the families have had, where they have in fact didn't want their child to go and seek help. That kind of situation also we have seen. So, but here also what you're talking about is a one extreme of the spectrum. But there are a lot of families who are willing and come with patients when sometimes willingly, sometimes not so willingly, they do come. But if you engage with the person and with the person's permission with the families, you always get better outcome for the problems. So the engagement with the families sometimes is making them understanding the problem, making them understand there is a solution, making them part of the solution is useful. Doesn't work always, but it works most of the times.
Okay, so convincing the family is also a very big challenge, isn't it?
It is very hard when somebody they don't see, they've seen a lot of problems in their life. They themselves have worked really hard and self-made people. They have come up sort of, after facing, for example, extreme poverty or other difficulties, and started working really hard and grew up in the workplace to become seniors and top management and stuff like that. So when they have been through all these problems, I faced all these problems, I'm here where I am today, and what is this problem? This is not at all a problem, and you're struggling with this particular issue, you are a weak person. This is a kind of sometimes not so helpful outlook, which might make it very, very challenging for the person who is suffering from the problem. Why I'm giving that as an example is the problems what any person is facing, how a person responds to that is not the same in all the situations. So some people if they are not able to, so the same problem, there are people who will cope better, but there are people who may not be able to cope. There's a different problem which other person who cope better may not be able to cope at all. So it depends from person to person, their individual vulnerabilities, their strengths, what might help, what might not help. So it is a challenge always engaging with the family, but whenever we have been able to engage families, the outcome is always better. Yeah.
Okay. So in the current generation, the Gen Alpha or the Gen Beta is what we say, right? So it's okay, I will do that for you, it's okay, don't get stressed, get whatever the child asks for, do whatever it takes for the child to feel good about himself or herself. Are we actually overdoing in the name of maintaining good mental health?
See, as you rightly pointed out, a lot of things are getting done for the individuals in the last few years. Like, for example, if we go back to our schooling days, the onus of a child performing better was on the at home, like parents, like teachers would say why he has not studied or why he is not passing the exam. So the onus was on the families had to do. Whereas now the parents are asking the schools and the teacher why my child is not doing well, why they're not getting better. So, for example, in health also, you get to see a person who has been smoking for 25 years and very bad lifestyle, drinking regularly and abusing themselves, using other substances, and they want their health to be better just like that. So there is a difference in how the society has been functioning compared to, like, say, a few decades ago and now. So coming back to this current generation, Gen Alpha, a lot of things have changed how it used to be and how it is now. But that doesn't mean the kids who are coming out of the system, the new adults now, we can't call them kids. So they don't have their strengths. It doesn't mean that. So they still have whatever the strengths they had. They also have their vulnerabilities. Maybe they haven't had the same type of challenges what the previous generations faced, but the challenges these kids, I'm going to use the term kids, so the kids are facing is completely different to what we were exposed and what we saw. And these are still challenges. For example, whether it is social media related challenges or the work related environment, what they come across compared to the type of works what we used to do or our parents used to do. So it's a completely different type of challenges. It's not easy facing, they may not have faced those challenges, but it's not easy to face the existing challenges as well. So it might be that they were a little bit more fortunate in getting things done or things happening to them, but that doesn't make it life any easy for the Gen Alpha as well.
So having said that, right, moving one step behind, the Gen Z, the young adults, like you said, whoever is out of college and into work, there is a very recent survey that actually went viral, which says that the managers are cribbing. Okay. So there is a recent survey, doctor, that managers are scared to recruit Gen Z kids. Because they say Friday 3 o'clock, I'm off. Don't come and ask me anything. That's the attitude, and that's how they respond to the management wherever they're working. So they're saying they are not able to put any pressure on the employees. Even if they put pressure, they simply resign and they go off. So that's the kind of attitude that they are coming up for the work, which was not the case when we used to start as freshers, right? So we'll say, it's okay, I will work for extra hours. It used to be the other way around. But these days, it's like, number one, it's a good thing that they are caring about themselves. That is no doubt about it. But is it a good thing in the change in the mental attitude towards work, stress, and work-life balance?
So coming to this type of why there is this mentality today where if you put too much pressure, then I may not stay in the job, I might go away. That is because today there is a lot more opportunities. Whereas the person who is telling or trying to give that extra work or trying to ask them to do more is the person who had much lesser opportunities in the society in those days. So the outlook was that somehow I have to sustain, somehow I have to manage, otherwise I might end up losing this job. And so whereas today it might not be the case. That's one. The second thing is also at home, sort of, it was compulsory that the previous, we're going back to what is the one before millennials, what do you call Gen Y, Gen
90s kids.
90s or even going back 70s, 80s.
80s,
so
boom, yeah.
So if you go back, so where the person who was doing the job, who started doing the job in their mid-20s, continued to do the same job or similar job till they retired. And so in those days, the opportunities were hardly there, and you had to just do what you have, and you had to cope with what was happening around you. So compared to that, today there is a lot more opportunities. When you did not have opportunities at all, the tendency is also there with the employer to push your boundaries, to make you do things even when it was not needed, and sometimes even go to the extreme of abusing as well. So compared to those things, today's generation is a little bit more fortunate, and in spite of all the different challenges they have more opportunities. They're able to say, my priority is me first, I need to take care of myself. So it's a good thing that they're able to do that. But it's probably my way of looking at this thing is, it's a misconception that they are not serious about life. They are not worried about their future. They are not passionate enough. That's not true. If they are passionate enough, they will continue to do what they are supposed to do even after hours sometimes. And I've seen many young people who are able to do that and who are doing that as well. We come across people who work really hard. I'm talking about, you said about Gen Zs and who have just passed out of college and doing. I'm sort of, I've seen some people who joined as marketing in our hospitals who work really hard. They come early in the morning, sort of 8 o'clock they start sometimes, and then they are staying at work beyond 6, going and meeting doctors and trying to make things happen. So just giving that as an example. So like that in different professions as well, you come across a lot of these young people who are doing it. So but there is that conception, people are not able to push them to do things what they don't like. So that probably is changing. People are prioritizing their life better. That's what is more important for me. What is number one priority for me and my life at this point in time? I'm going to do that. If it is seeing my partner, I have to really go and see the person today, because that's important for me to maintain this relationship. That is going to be the number one priority. So in that way, so they are able to prioritize things better, because they don't have that insecurity today. So even at home, there is probably a little bit more affordability to be able to sort of, you don't have a job in between. You might be okay to sort of, few months and before you being unemployed for a few months before you trying for a job. So those kind of opportunities are there today, where it was not there before. Right. That might be the reason, I think, but that's what I would say for that particular. Okay.
So I think the managers are going to be like, no, that's not the case.
they have to think differently. They have to use what's going to be stimulating for those young people, what's going to help them to sort of, the managers I'm talking about, help them to get more work out of these youngsters. Right. And that is the way they are supposed to function. They also have to change the way they have been functioning over the years.
True. Yeah. So that's a piece of advice for all the managers out there. Okay. Yeah. For the entire IT fraternity, that's
absolutely,
a big piece of advice.
They also means, I'm sure they are also aware, and they are looking into those aspects as well. Right. So if you look at new workplaces, some of the IT industry, what they have, it's fantastic. So they have all kinds of things happening in those workplaces. Sort of in terms of recuperating, recovering, whatever the sort of, in between breaks and what all different activities that can be done, all those things are happening within the workplace. That's a really good thing. Yeah.
Right. So, okay. So, doctor, talking about kids and pampering and many other things in this generation, right? What are the common problems that the kids are coming up with these days?
Okay. So, kids generally present with different ways. The problem, whatever they might be having, sometimes it is that they are refusing to go to school. That might be a way of presentation. Sometimes in the school, they are frequently getting into problems, or they are not performing in their academics, or they are getting into trouble at the playground. So, different type of things. And also at home, they are not sleeping, they are not eating well, they are getting sort of, tantrums frequently. So any of these kind of presentations, which usually they come to us. So when you try and assess, then you try to if it's school related problems, for example, the conditions might be, they might be slow learners, and they might be having a particular problem, what we call as attention deficit hyperactivity disorder. Or when coming to the slow learners themselves, it might be to do with sometimes their IQ itself might be low for various circumstances. It might be birth related injury, or it might be growing up they had severe illnesses, or they had seizures which they repeatedly continue to have seizures, and then that affected to some extent their brain. So any one of those things might have affected. So that type of problem. If what is the advantage of getting it diagnosed or so, is that people know their limitations, people are able to help them accordingly better, rather than knowing that you're not just studying, you're not just getting enough marks and being very harsh with them. If you understand, they might be able to handle it better. That's one. Then there is other problems when you frequently have academic problems. There is this thing called a specific learning disability. That learning difficulty might be because of to do with maths, or to do with languages, to do with writing, or to do with reading, any one of those kind of problems. So if you identify the problem early enough, the rectification also can start early. So over a period of time, they develop the skills to address these deficits, and they might come to some a normal range they can reach up to. Or even if they are not able to reach up to normal range in those aspects, they might be able to, the skills might be good enough to help them to reach a a good functioning level, which they might not have achieved if they had not taken that particular help. Coming to attention deficit disorder, so in that there is kids who have, along with attention deficit, they also have hyperactivity. Then there are kids who have do not have hyperactivity but only attention deficit. So what can be the problems? The problems can be, if there is a kid who is suffering from attention deficit and hyperactivity, they can be extremely disruptive. They keep troubling their kids who are sitting next to them. They become extremely challenging and trouble teachers as well. They can run around in the class without realizing what they are doing. That might be hyperactivity. Whenever there is hyperactivity, the problem tends to get recognized a bit faster. But then there are certain kids who are bright but have attention deficit, who, because of being bright, they somehow manage and once they reach a crucial stage, their performance starts getting affected, and suddenly you get complaints that extremely bright till 2 years ago they were toppers and now they are not able to perform.
That's a very common problem.
So that kind of situations. So where they are not able to focus, not able to concentrate, they daydream, they are not able to fulfill the homework or assignments at the right time, they postpone a lot of things, and that kind of a problem. That can be because of attention deficit disorder. If it is identified in the early stages for both the attention deficit with hyperactivity, without hyperactivity, lots of treatments are plans are available. Then there is medication which can help them, and then there are behavior strategies and techniques which you can teach the kid and the parents, so how they manage. So with those strategies, definitely it will help. One of the important thing that helps the kid in all these aspects is really good physical activity. And if they are good at sports, or even if they are not good at sport, if they can be encouraged to pick up some kind of physical activity, some kind of a sport, whether it is football, tennis, whatever it might be, if a good physical activity is going to be extremely helpful for all the kids in terms of their brain development, brain maturation, and overall in the long run achieving their better functioning levels. Okay. So it can be the intelligence related problems, then we spoke about the learning disabilities, and then attention deficit. And of course the common mental illnesses which afflicts the adults can also affect the children. For example, anxiety, depression. So the kid might not be able to tell I'm depressed. It might just be avoiding going out. It might be crying all the time without telling why they are crying. So these problems manifest differently, but once you start, like if a trained person assesses them and sees them, they might be able to see the problem, and in certain circumstances, if they need particular treatment, that can be started. So the common illnesses, mental illnesses which affect an adult can also affect a child, but they might manifest differently.
So will they be able to overcome the disorder if identified early at an early stage?
If identified early, see, look, the child, if you take, the development of the child's brain is happening. For example, the development go on, like say, till 20 in females, and even for boys, it can go on till 22, 23, even sometimes up to 25, the overall maturation of the brain functioning and their development and all these things. Because your brain development is affected by your growing up environment, your childhood, your neighborhood, your schooling, your teachers, the friends you have. All these things contribute to the child's development. So if you assist the child in maintaining a good development throughout the period, the overall outcome will be a lot better, isn't it? If a child is having, for example, at the age of 10, 12, suffering from depression and never got help, the child may not be able to achieve the potential what finally the person might have managed, because they didn't get the help. The deficits persisted. The deficits persisted to the extent of affecting their personality development, their overall confidence in life, and things like that. If they had received that help at that time, they would have overcome that, and that might not have been the factor when they finally grew up and got better, reached their functioning level.
Okay, interesting. So, how important is school and school system in supporting a child's mental health?
It is like we were just talking about what kind of things helps the overall development of child. So from that point of view, school is an extremely important part of childhood. School is where you learn a lot. School is where you develop a lot of skills, and school is where you get to interact with different people. So a lot of development happens in school, and as kids we spend considerable time. Out of 24 hours, nearly 6 to 8 hours you're spending. So 1/3 of the time you're spending in the school. So that's a really big chunk. So that's one of the most influential thing in our lives, which shapes us and which makes us whatever we are today. So from that point of view, school is a very important place which should not be ignored, which should not be neglected. So whatever the help that needs to happen at school, if at all it is possible. So from that point of view, the scope is huge, the potential is huge. But is it happening? I think that's a big if question. It is happening in a very few schools, not happening in all the schools. Some of the really good schools might have school counselors, and all their teachers might be trained in identifying the problems and so, but that is in a very few schools. So when the problem is so huge and the potential is so much, so how do we address that problem? But there has to be a starting solution for any of these problems, right? So with such huge problem in our society, in our kind of schooling system, I think the first thing we need to focus on is helping the teachers understand. So focusing on teachers' development and making in their whether it is during their B.Ed programs or M.Ed programs, or where they are trying to be teachers and trying to develop their careers. So whether they can have mental health related workshops or modules where they learn about it and their understanding improves, and how to identify, if not intervene. So what can they do, where they can point signpost, where to go and seek help, those kind of things. And so if we can address that to even like say 5-10%, it's going to be the outcome is going to be huge in terms of our schooling system, what we have got.
So many schools actually, they say they're all inclusive. They're an inclusive school is what they claim to be, but they have the differently abled child in the same classroom with the others. Is that still okay?
So differently abled child, again the spectrum is huge.
Okay.
Sort of, if the differently abled child where the deficits are a lot, then they might do much better in special environment where there is different types of inputs. But for a child with a problem is there, but it is not so much affecting its functioning, little bit of support to them helps them to sort of function better and get on with the normal schooling process. In such situations, it is helpful.
Okay. Social media and psychology. What is it? Do you think it's helpful or harmful?
So, social media, we like it or not, today it is part of our lives. We spend a lot of our times with social media. So, if there are topics and if there are discussions happening about mental health, about the problems, it is good in any way. Any kind of discussion that's happening, it's a good only. But unfortunately today a lot of things which shouldn't get the publicity what they are getting today, it is happening. For example, if you take overall society, it's much easier to get people interested in conspiracy theories than actual facts.
True.
Right, isn't it? So similarly, it is in social media you can sort of get treatment, supposed to be treatment interventions which are supposed to be sort of pushed on as treatment interventions. This helps, and you sort of go and see this person and or use this ring with special stones.
Yes.
and do this particular puja and your problem will be sorted. Even these kind of things get pushed as part of solutions for mental health related issues. So the social media can be throwing good information, can be throwing sort of extremely absurd message, but how we are going to use is what matters to the person who is actually consuming it, isn't it?
Right.
So which is like the case with anything in life. There are all kinds of things available, but how you are using that information or that particular message, and which you are going to make part of your life is actually left to the person. So if everything that is coming on social media is not truth, sort of be aware and sort of ask questions. Don't believe everything that is coming there, whether it is good or bad. Just think. You make up your own mind. Sort of ask questions, and if there is doubts and when there is this thing, so don't hesitate to ask question. So and don't hesitate to go and see the specialists and ask the questions, and then you can make up your mind, isn't it? So social media is not going to go anywhere. It's going to be there. It's going to, if anything, its influence is going to become even bigger than what it is today. So it is for us to have that ability to see what is right and what is wrong. That's something. Maybe our school systems, maybe those are the things like where they can assist the new kids and the new generation who are coming out how to analyze this, how to assess this, and give them the skills so that they will manage whatever is happening in social media.
True, yeah. A digital way of giving solutions.
Yeah.
All right. So, doctor, moving on. What is the one funniest misconception about psychiatry?
So, misconceptions only if you take, there's a lot of misconceptions.
Okay.
For example, the psychiatric problems are problems for rich people. So, it affects the weakest type of person. All these things are misconceptions. But the funniest thing what you see is actually like a psychiatrist can read your mind. So that's one common thing. Like if you say you're a psychiatrist in a social gathering or so, then some people sort of worrying and they start getting to sort of hide from you, and they stop talking to you. And that's probably one of the commonest and funniest kind of situation we come across. The other thing which commonly being thrown at you is that a split personality, they use this term, isn't it? Where one person will not be aware of one personality. Same person will have two different personalities and this thing. So that how it happens in extremely rare kind of things, but which gets used sort of very commonly in normal conversations and things like
Okay.
that. So that I would say is
A funniest misconception.
yeah.
All right. So you'd see so many patients with so many mental health issues day in and day out. How do you actually handle the emotional weight of your job?
I think that's a really difficult part of our job, and I was talking to you when I said about my training in Nimans, and because of the sheer number of people whom you see, you tend to become over a period of time non-judgmental. But the challenge is when you're becoming non-judgmental, at the same time you should not lose your empathy, and where you are able to relate to people. That is a fundamental part of your job. So you cannot lose that empathy. You still have to be empathetic, and you still have to be non-judgmental, and you still have to be able to let go, and you still have to keep doing the same thing every day. That is the biggest challenge what you have. One thing is, you sort of over a period of time you learn that you cannot be omnipotent. You cannot sometimes help in spite of the wanting to help, and in spite of wanting to do the right thing. So knowing our limitation, and these are very important part of our training. You learn these things over a period of time, but being empathetic is the foundation important thing which you have to do in spite of all these things. How do you look after yourself? And ideally, what is good for anybody, including you, same things which is going to work for me as well. What is that? One is, of course, having a decent lifestyle, making sure exercise being part of our life, and these things are definitely helpful for any person, and definitely helpful for any psychiatrist as well. The other thing which helps us in doing the job what we do is ability to let go, ability to be more forgiving, ability to be able to forget sometimes. So these are all things which help us. The more it's not just about telling that, it's about practicing these things as well. When you practice these things, it's about practice yourself to forgive more. It becomes easier. So more of that you do, the more easier it becomes. So then that's the way you look after yourself. That's what I would advise to a young psychiatrist.
Okay. So, we're adding on one more, right? So, is there one incident that has actually shook your entire perspective about psychiatry?
Psychiatry in '96, so it's almost going to be 30 years, and I've been a psychiatrist for the last 25 years. So, I had read about these things and came across this situation in the past as well. But recently again came across this situation where in their mid-30s, the couple came to me where they had lost their 6-year-old child to cancer. In spite of being aware, in spite of seeing such situations before, in spite of reading about it and everything, this particular situation when I came across recently, it affected me very badly, and where the emotional ups and downs, what they were going through, I started seeing them when the kid was still alive, and the last stage of life, and where they lost the kid, and subsequently what they were going through and how they were handling it. So it makes you question everything what you believe in. So including what you learned, and what not just in psychiatry, in life, everything. So that was probably one recent incident which affected me very, very strongly. I wouldn't say badly, but very strongly it affected me, which needed a lot of corrections within myself to deal with it and to continue to be there with the parents and work with them. So that was what.
Hard hitting.
Yeah, yeah, yeah.
So moving on to the rapid fire section, I have a couple of questions. It can be just a jiffy answer, that's it.
Okay.
Okay. So if you have to tell a quick hack for the youngsters in the IT field when they are anxious or stressed, what would it be?
Learn to challenge. So what's the worst thing that can happen? Ask that question.
Okay. Coffee or tea?
Coffee.
Early bird or night owl?
Night owl.
Okay. One book for mental illness?
So I wouldn't say one book particularly for mental illness. I read a lot and I do enjoy books. But purely if you want to talk about mental illness and or anything related to a person's development and practicalities, I would say use the principles of Bhagavad Gita, I would say. So from that point of view.
Okay.
Yeah.
A movie that shows mental health?
So As Good As It Gets by Jack Nicholson, especially he has OCD and it's beautifully depicted and I really like that movie.
Alright. Dream dinner guest, dead or alive, anyone is okay.
Dr. Rajkumar.
Okay. That's a big name, okay. So Freud or Jung?
Freud.
Okay. What is a very common underrated emotion?
Anger.
Therapy or medication?
Therapy.
One line mantra that works for you.
Be kind to yourself.
That's been amazing, doctor. Thank you so much for your time. I think it was a wonderful insight about mental health and how people, what is the time when somebody should actually come and meet a doctor and take that help for themselves. So I think our audience also will have quite a lot of information about it and step out and go see the doctor and seek help when required. Thank you so much for your time.
Thank you, man. Thank you. It was a really nice interaction.
Thank you,
Thank
doctor.
you.